Hello, I'm Andrew Paterson, a consultant gynaecologist at Ross Hall Hospital, part of Circle Health Group. I specialise in all areas of gynaecology and have a particular interest in surgery for gynaecological conditions. One procedure I perform regularly is a myomectomy, which is a surgical treatment for fibroids. In this video, I'll be answering some of the most common questions I get asked about this procedure, including what is a myomectomy, how long does it take to recover from a myomectomy, and can you still get pregnant after a myomectomy? What is a myomectomy? A myomectomy is an operation to remove a fibroid, also known as a myoma, which is a non-cancerous tumour that grows in the uterus. Fibroids can cause several symptoms, including painful and heavy periods, frequent urination, lower abdominal pain, and problems with fertility. Just because you have a fibroid doesn't mean you need surgery or even treatment. Some people have fibroids and don't even know it, as they aren't always symptomatic. Some people have symptoms that can be treated using non-surgical options, for example, hormonal medication. But if your fibroids are affecting your fertility, or it is thought that they might go on to impact your fertility, your specialist might recommend a myomectomy. Is a myomectomy a major surgical procedure? A myomectomy is generally considered to be major surgery. Even if your surgeon uses a minimally invasive approach, a myomectomy is a complex procedure with a significant recovery time and is typically performed under a general anaesthetic. With any surgery, there are risks and potential complications, and this is why you will only be recommended a myomectomy if your fibroids are significantly impacting your quality of life or your ability to get pregnant. What happens during a myomectomy? A myomectomy is performed either as an open or minimally invasive abdominal operation under general anaesthetic. In open surgery, we make one incision either across the bikini line or in a vertical line down the abdomen, depending on the size and number of fibroids to be removed. Very occasionally, a second incision may be needed. During minimally invasive myomectomy, we use thin surgical tools to access and remove the fibroids with 3 or 4 small holes. Once the incision has been made and access to the uterus has been established, any fibroids will be surgically removed. Sometimes a drug will be injected into the fibroid in order to help prevent excessive blood loss, or a tourniquet will be used on the fibroid to cut off the blood supply. With the fibroids removed, your uterus will be repaired and the incision will be closed and either stitched or stapled together to complete the operation. In some instances, you might be offered a laparoscopic or minimally invasive myomectomy, which is where your surgeon inserts specially designed tools through small holes to perform the operation without opening you up. A laparoscopic myomectomy might have a shorter recovery time than an open myomectomy, but it won't be the best choice for everyone. How long does it take to recover from a myomectomy? After a myomectomy, you should expect to stay in hospital for a few days, where you'll be looked after by a specialist team. You'll probably have a catheter at first, which is normally removed the day after your surgery, after which your nurses will get you up and start walking again. Once you're eating, drinking and urinating normally, and your pain is under control, you'll be able to go home. And as I said, you should expect this to take a few days. It can take between 6 and 8 weeks before you're ready to return to work, depending on the nature of your job, and your consultant might recommend that you don't lift anything heavy for 12 weeks while your body recovers from the surgery. Can you still get pregnant after a myomectomy? Myomectomies are usually performed in order to preserve fertility, so hopefully you will be able to get pregnant after you have the operation. It's not something we can guarantee because various factors come into play, including your age, your fertility levels before surgery. The main alternative to myomectomy when it comes to fibroid surgery is hysterectomy, which is the removal of your womb or uterus. A hysterectomy removes your ability to get pregnant, which is why a myomectomy is the best choice if you're still hoping to have children. Thank you for watching this video. If you have any more questions about having a myomectomy or anything else I've mentioned in this video, comment in the section below and we'll get back to you as soon as we can. If you would like to arrange a consultation with me to discuss fibroids, myomectomy or any other gynecological question, you can book an appointment with me at circlehealthgroup.co.uk. Thanks again.